Welcome class to Chapter 11 Capillary or Dermal Blood Specimens lecture. As you know, skin punctures, there are benefits to doing skin punctures on a patient. It has a chance of diminishing risk of iatrogenic anemia or acquiring a Sharp's injury or injuring to a patient such as any particular nerve damage as may be sustained if we do a venipuncture, and sometimes it's less painful for the patient than doing a venipuncture draw. Skin punctures provide capillary blood samples that are particularly useful for both adult and pediatric patients. When small amounts of blood can be used for laboratory testing, for pediatric patients, it is critical to withdraw only the smallest amount of blood needed for laboratory testing in order to reduce the effect of blood volume reduction, because babies don't have very much blood whenever they have smaller amounts of blood supply than an average adult would have. When the laboratory test requires small sample sizes, the use of capillary puncture in lieu of venipuncture can produce several benefits. One of these benefits is it's very it costs less for the equipment and the supplies needed for a capillary or skin puncture test. It's usually faster than doing a venipuncture, and it's easy for self-monitoring diabetic patients. It can also reduce the likelihood of causing any injury or complications, especially in children and infants. It can also help with anemia, patients who have sustained cardiac arrest. They are hemorrhaging, so they're losing a lot of blood. So we can do a capillary draw to maintain or not to cause any further damage due to the patient is already bleeding out. So us drawing blood in large amounts will cause more harm. Venous thrombosis, reflex atrial spasm, gangrene of extremities. Those are things we can eliminate or reduce the risk of, especially in patients, by doing a capillary blood sample versus a venipuncture sample. We will reduce the risk of any damages to tissue or organs. Excuse me. Less likely for them to get some kind of acquired infection due to a capillary blood draw. And it would also decrease injuries from having to restrain a child during a like we would have to do during a venipuncture draw, because it's less invasive, should I say. A capillary blood draw is less invasive than us trying to do a venipuncture. For adult patients, um, if blood volume requires are small, skin punctures for adults are often used when the following conditions occur. If a patient has severe burns on the arm, obesity, thrombotic tendencies, fragile veins, such as when they're in geriatric patients, saving of veins for therapy, such as people who are in oncology or cancer patients, for self-testing, such as diabetic blood glucose screening, and for point of care testing, because now we can do, as far as point of care testing, not just glucose, we can also check for PTINR from point of care. We can also check hemocrats and hemoglobins from point of care. We can also check lipids, triglycerides, cholesterols from a point of care machine, which is just a simple finger stick to the patient's finger instead of drawing a whole tube through venipuncture. Sometimes sometimes a skin puncture cannot be used because tests may require larger amounts of blood. Swollen sites or fingers may cause interstellar fluids between the tissues to dilute the blood. The patient may be dehydrated, therefore a skin puncture is less likely to produce blood drops. The patient may have poor um, peripheral circulation, which is circulation near the surface of the body. Coagulation testing cannot be done through a skin puncture test. Blood cultures cannot be collected through a skin puncture, and we can't do a set rate or ESR determination through a capillary skin puncture. Right. Common laboratory tests used with capillary blood samples. Some of the common labs we can do as far as when we do a skin puncture or capillary test is we can um, do a blood smear for a manual white blood cell count differential. We can also do a complete blood count or CBC, hemoglobin hematocrit, from a capillary blood sample. We can check for electrolytes, neonatal blood gases such as bilirubin, neonatal screening, which is the PKU, and point of care or home or self-testing such as glucose. All these can be done with a capillary blood sample. Composition of capillary blood. Capillary blood is made up of, um, is quite different from a venipuncture sample. Capillary blood is composed of a mixture of blood from the areolas, venules, capillaries, and intracellular and interstellar tissue fluids. The exact proportions in a capillary blood specimen from these sources are not known. However, the proportion of arterial blood will be greater because the atrial pressure in the capillaries is stronger than the venous pressure. So you'll have more you'll have more atrial blood flow than venal blood flow due to the pressure. Preparation for skin punctures is basically very similar to steps as well as a venipuncture. It's just you're not using an eclipse or a butterfly or you're using a lancet. So it's similar to the same way you would greet a patient or obtain a venipuncture. You still have to explain the procedure to the patient. You still have to get them emotionally prepared. You still have to make sure you use basic forms of hygiene and infection control. You must also always make sure you identify your patient, pay attention to any details, and always assess your patient to make sure that they are mentally capable of handling the procedure and without stressing them out. Just like venipuncture draws, if a patient is stressed out, it can alter test results. Even though it's just a finger stick, some patients are still apprehensive of finger sticks. Always greet, assess, identify, and position the patient in the most safe and comfortable way you can, not only for their safety, but for your safety as well. Make sure you always perform hand hygiene and glove techniques because we are dealing with droplets of blood, so it is more exposed than if we do a venipuncture draw. because the venipuncture draw goes through the barrel of the needle, through the bevel, through the barrel of the needle into the tube itself. With a capillary draw, we're actually dealing with the drop of blood on the outside and putting it into a tube by scooping it into a tube. So make sure you perform proper hand hygiene and gloving technique. Always prepare your sample and the micro collection devices the same way you would do when you would get ready to do a venipuncture draw. You still have to get the appropriate equipment that goes with the appropriate test for the appropriate patient. If a specimen is supposed to be fasting or basal, you have to make sure that the patient has followed those directions. Make sure that your patient isn't latex sensitive. If they are likely to faint, because even though it is a capillary stick or finger stick, some patients just have that tendency to pass out because it's their bodily fluids that are leaving them. It's their blood leaving their body, and they still can pass out even from a finger stick. Select your site, warm it if necessary, because some people do have cold fingers. So you must make sure it's warm, because if the hand is cold, you're not going to get a good blood draw, or you're not going to get a good capillary site. Make sure you clean your site very thoroughly. Make sure you open the sterile puncture device within view of the patient the same way that you would do if you were doing a venipuncture. Everything has to be open and prepped in front of the patient so they'll know that it is sterile and that it is clean. Perform the puncture and wipe away the first drop of blood unless specified for certain POCT tests. Some POCT test devices, you don't wipe the first drop, you have to wipe the first 3 drops, or you might not have to wipe anything. It just depends on the directions of what that POCT test is calling for. Obtain the specimen so desired that is ordered by the doctor. Apply general pressure to the wound using a clean gauze pad and bandaging up the patient if they so say need a bandage. Make sure you discard your lancet in a biohazard container. Make sure you label your specimen and prepare for transportation. Now always remember, if what you're drawing, even if it is a capillary sample, if it still says protect from light, protect from light. If it still says place on ice, you still have to place on ice, even though it's a little bitty little tube. Assure bleeding has stopped, and always thank your patient for letting you draw on them before you leave the room. Puncture devices can come in a variety of styles, shapes, and depths. 2 types are the puncture device that use a needle or blade that goes vertically into the skin, which is the lancet. And then you have the incision device that makes a small slice into the capillary bed. We don't necessarily use that technique. We use the puncture device, or the lancet device is mostly what we use in the lab. Make sure you also have disposable gloves, which is a gimme. All gloves get changed out after each patient. Sometimes even if we're dealing with the same patient, if those gloves become soiled or a hole gets in them or anything, we discard the gloves anyway. Make sure you have a sterile single-use retractable safety puncture device. Make sure you have a disinfectant pad and a sterile hypoallergenic Band-Aid or gauze pad. Now, don't get me wrong, some patients are allergic to Band-Aids, even if it is hypoallergenic. It's the adhesive sometimes that gives them allergic reaction. So please ask the patient before you just stick a Band-Aid on them if they're allergic to any adhesive or Band-Aids. Supplies for skin puncture. If we're doing a skin puncture, the supplies that we would need is a glass microslide for doing WPCs. We would also need diluting solution or fluids. We would also need a plastic microcollection tube or plastic capillary tubes, sealer or closer. If we're doing capillary tubes, there is a clay that we pump off the tube with so the blood doesn't just slide on out, because you gotta remember it's just a thin glass cylinder tube that we're putting blood into. So how do we keep the blood in it without it dripping out again at the other end or at either end? So we'll caulk it off or clay it off on each side to keep the blood inside the capillary tube. Make sure we have our lab requisition or labels so we'll know what labs we need to be drawn. Because like I said, if we don't have requisition or labels, we cannot just stick that patient willy-nilly. Some kind of marking pen for you to mark your initials, time, date, sample was collected. And of course, biohazard containers, because everything has to be transported back to the lab in a biohazard bag. Some preferred sites for puncture. Skin puncture are older children most often involves one of the fingers. The preferred site for obtaining a capillary blood specimen are the fleshy center polymer surface of the dorsal phalanx, which is the fingertip section, or the third or middle finger, or the fourth, which is the ring finger of the non-dominant hand. The site must should be warm, free of calluses, burns, cuts, scars, bruises, or rashes. The fingertips should not be cyanotic or bluish in color, luminous, or infected. The puncture should be made slightly off-center at the thickest fleshy part of the finger because the peak of the fleshy part is sometimes callous, and this off-center area still allows a puncture in a place least likely to penetrate any bone. Punctures should not be made on the side near the nail's edge, nor on the tips of the finger because of the risk of hitting the bone. Right. On children, on infants that are less than 1 year old or neonates, you use the lateral medial palmar side of the heel, meaning either inside or outside of the baby's heel. No, to do a puncture. Okay, sites that are not recommended for skin puncture, and this is kind of like a duh moment. You definitely don't want to do somebody's earlobe. This is due to the possibility most people have ear piercings in their eye, in their ear, and you definitely don't want to be anywhere close to the patient's eye, especially if they suffer from anxiety. As you know, if somebody was getting a ear piercing machine or that gun, as they call it, it takes a lot of patience. It takes a lot of perseverance because one wrong move antsy and they get have a really bad anxiety. So just imagine earring gun puncture somebody's earlobe. Yeah, not happening. Central arch area of an infant's heel and posterior curve of the heel due to risk of injuring nerves, tendons, cartilage, and bone. So if we go in the center of a baby's heel and try to do a stick, we can cause serious damage to the fact that he won't be able to walk on that leg at all due to the bone damage that was done or the nerve damage that was done due to a misplaced puncture, lancet puncture in a baby's heel. Other places we cannot draw or don't recommend for a skin puncture is fingers of a newborn or infant less than 1 year old, due to the simple fact that we may accidentally hit a bone because they don't have very much flesh or fat yet. Um, they just born. They're not chunky. They don't have their fat cells accumulated yet. The fifth, pinky finger, you run a risk of hitting bone due to the thinner tissues in that area. It's not as fleshy, or yeah, it's not as fleshy as the rest of your finger, as your third and fourth finger. We don't do our thumb because we can feel a pulse in our thumb, and we don't do our index finger or our pointer finger because it is the most sensitive finger we have. If, for example, you have the third and fourth finger are swollen, are infected, or previously used as a puncture site, we don't try not to go in that same finger again. We try to go in another finger or an alternative finger of the non-dominant hand. But if we do have to go in hand, just be mindful how you do your lancet stick. Try not to hit a bone, a nerve in that person's hand. Fingers on the side of the mastectomy, where the lymph nodes removed during surgery, may result in fluid buildup. Consult the physician if it is a bilateral, meaning a double mastectomy. We would definitely have to contact the doctor and see what we can do as far as any capillary labs we need to collect for that patient, if we have to collect any. Palmar surface of big toe, no scientific effects that support its use, meaning why would you use somebody's big toe? It doesn't have any scientific evidence as to say nay or yay, yes or no, we can't use it. It's just something that is understood to not be used as a site. Improving site collection. Make sure you do not use fingers that are cold. It is likely that blood flow after the skin puncture may not be abundant enough for an adequate sample. Always warm the skin puncture site, which helps facilitate phlebotomy by significantly increasing the arterial blood flow to that area. Capillary specimens from warm sites can be described as arterialized capillary blood. Lowering, lowering the arm. Sometimes this helps when you lower the arm of the patient. Just have them simply dangle the arm for a few minutes, which would allow gravity to fill the capillary beds of the fingertips, which makes it a little easier for us to obtain capillary blood samples. The skin puncture site should be cleaned with an alcohol pad containing a 70% aqueous solution of isopropanol. You must allow the site to dry thoroughly before punctured, because residual alcohol can cause rapid hemolysis and may contaminate glucose determination. Iodine tincture preparations are not required are not recommended for disinfecting skin puncture sites because they can falsely elevate potassium, phosphorus, and uric acid determination. Acquiring a capillary blood sample, dermal, or skin puncture using a retractable safety device. So basically, always be mentally prepared or mentally prepare the patient by greeting the patient and putting them at ease. Always position the patient in a safe chair, comfortable bed, or reclining chair to ensure proper patient identification before you do a dermal or skin puncture test on them. Exercise standard precaution and always perform hand hygiene and glove technique because, like I said, we are dealing directly with a drop of blood itself. You definitely don't want to do this procedure without any gloves. Always prepare your supplies, such as your puncture device. Verify any dietary conditions, latex sensitivity, and likelihood of fainting. Always ask about hand preference. Check hand dominance. Your patient knows their body better than we do, so usually we'll say, which hand would you like to be drawn in? If they don't specify, then we usually go for the non-dominant hand. Once you have chose your hand and which hand you're going to do, you're going to next need to choose which finger you're going to use and make sure that that finger is warm, that it doesn't have, that it's not cold, it's not swollen, and it's not bluish in color. Then you're going to clean it with your alcohol prep and let it dry. Once it has dried, you're going to remove your sterile puncture device or your lancet from packaging and follow the manufacturer's instruction as far if you're doing a POCT test. You're just doing a capillary drain. With the other hand, position the puncture device on the site that you're going to stick in. Activate the release mechanism on the retractable safety puncture device and hold it perpendicular to the finger surface. Perpendicular means across. Across, 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 across. Orient the incision or puncture across the fingerprints to generate a large round drop of blood. Discard the puncture device in a biohazard container. Always gently use the finger to expel the first drop, and you would collect the second drop if so test says to collect the second drop. If not, it may be the fourth drop you need to collect. It all depends on what test and what type of POCT test instrument you're using. Gently apply pressure to the finger once you have acquired your capillary or dermal draw. Hold the puncture site in a downward position to discourage free flow of blood to flow, and do not excessively milk or massage the finger to force the blood to come out for you to scoop in order to get the blood sample. This is the reason why we don't over milk it or massage it is due to the fact that we might cause the specimen to hemolyze due to the excessive tissue fluid that may be found from over milking and over massaging your finger. Each type of microcollection tube has different tubes and blood volume requirements. You will always follow your manufacturer's instruction on these tubes. These tubes are itty bitty little teeny weeny tubes. They are really, really, really tiny. Once you have acquired the blood in the microcollection tube, you're going to invert or gently invert it with the additive that is in the tube. the number of times that is required that you have to do this. And then you're going to seal your microcollation tube very carefully because you don't want any of it to leak out. It's already a small tube, and if something already leaks out, it just defeats the purpose of you trying to get the finger stick in the first place. When you are filling a capillary tube, do not allow any air bubbles to enter the tube because air can cause erroneous test results. Blood flow is better and air bubbles least likely if procedure site is held downward and gentle pressure is applied. Blood smears can also be made from uh, sufficient or sequential drops of blood. If you refer to procedure 11.2, it will explain how this procedure works. All right, after you have collected the specimen, always make sure you use a clean gauze to apply pressure to the site and make sure you mix until the bleeding has stopped. Always label your specimen in front of the patient and always prepare to be transported back to the lab in a biohazard bag. Discard any biohazardous material in its appropriate space, meaning sharp scissors, sharps, bloody gauze, bloody gloves, etc., goes in the biohazard trash can before leaving the patient's room. Always remove and dispose of gloves in the biohazard container. Perform any hand hygiene if you don't have access to soap and water. Always remember that hand solution can be used also until you can get to soap and water. Always double check to make sure that bleeding has stopped on your patient because you don't want to walk out and the patient is still bleeding from their fingertip. And just before leaving, always thank the patient and make sure you have your specimens and all equipment is out of the patient's room or back in your tray, and you transport the specimen to the lab for examination. Right, we're going to stop right here for today, and we're going to pick up on other considerations on tomorrow. It'll be lecture part 2. If you have any questions or comments, please feel free to text or message me. I thank you and you have a nice day. Bye-bye.